Well, thank you very much, Michael, Professor Glickson. Dear colleagues, ladies and gentlemen, it's a real pleasure to be here again in this joint session of the European Society of Cardiology with the Israel Heart Society, which is a member of the big family of the European Society of Cardiology and has been a member since 1998 and has been deeply involved with the different activities of the society. I will just give you now for the next 10 minutes or no a little bit of what we are doing and what we are doing together, and basically what the Israel Heart Society is also contributing to the development of the European Society of Cardiology in many areas. Our mission is to reduce the burden of cardiovascular disease, and we've been working very hard not only in Europe but around the globe, and together also with some of our colleagues from other parts of the world. And the core strategic objectives can be summarized in these three main topics, which basically we all agree on, and we all feel comfortable with these objectives: to advocate for the quality of cardiovascular care and the application of standards and guidelines, to be committed with the dissemination of the scientific knowledge to the highest quality and serving the interests of the patients, and build a community of cardiovascular specialists. And this is what makes working together makes a difference, and why it's so important that we work as a single community. The European Society of Cardiology today is a large society. It's constituted of 56 cardiac national societies, and on top of that there are 41 affiliated societies, 6 associations, 15 working groups, 5 councils, basically covering the full breadth of cardiovascular medicine. So whatever you do in cardiovascular medicine, there is certainly one area, one working group, association, or council where you can meet your peers and discuss the issues related with your own specialty or subspecialty. This basically summarizes the way we are structured, and of course we're very happy to have a participation of colleagues coming from Israel in these different areas of the European Society of Cardiology. We represent today more than 95,000 health professionals in the field of cardiovascular medicine, and over 70,000 are represented in the national cardiac societies. The fellowship of the ESC, which is considered as a symbol of excellence, the AFESC, we're very happy to have 80 members from the Israel Heart Society, which is a substantial number considering the size of the society and the total number of fellows, but certainly we very much appreciate the presence and the participation of colleagues coming from Israel in our activities, in particular at the highest level, which is being a fellow. One area where I'm particularly proud of, because was at the time I was chairing the Congress, was the development of the cardiologists of tomorrow and the involvement of the young community in the activities of the society. This started to be in the general terms, and now many of the associations already developed their own young community. This is a great success, and I'm very happy also when I was here a few years ago for the inauguration of the Cardiologists of Tomorrow section, if you will, of the Israel Heart Society, that I know that has been very active, developing a lot of activities, not only in Israel, but also contributing to the activities of the group, the European group of Cardiologists of Tomorrow. And certainly this is one area that we all very, very proud of, because basically we're getting the young blood, new ideas into the society. We've been working in many fields. I will just summarize here some of the most relevant: on guidelines, on registries, developing different educational programs. We have just launched the general cardiology structure within our website with about over 200 different courses, and this again has been done because of the contribution of many colleagues, including colleagues from Israel. Our guidelines, which again now they're being adapted by and accepted and endorsed by all our national cardiac societies for a few years now, that our guidelines are the guidelines of the different individual countries of the ESC, and I know that they also have been extensively followed here, disseminated. Of course, that's the big challenge everywhere, to disseminate and do implementation of the guidelines, and this is done through education, and is then assessed through different ways, including disseminating through our journals. We have a big family of journals, and also a lot of colleagues coming from this country are part of the editorial board of many of these journals. Our flagship journal, the European Heart Journal, now is the second in the ranking of journals in cardiovascular medicine with an impact factor of over 15. And then we have all the different types of journals that basically are related with the different fields in cardiovascular medicine. We're also changing the concept of textbook. We're developing the new edition of the textbook, which will be completely different. It will be linked with the guidelines. It will be linked with the registries. It will be more modern, more dynamic, more with an update, which we want to be very fast, and to basically have a more modern way of providing education through a textbook. And also many of the subspecialties have developed their own textbooks. And again here, we also appreciate and thank the contribution of specialists and experts from Israel. The Euro Observational Research Program is a big program of registries. It followed the EuroHeart survey. Now we have more than 14 registries ongoing. And again here, I also have to thank the participation and contribution of the Israeli community for these registries and of the society, which is involved in some of these registries. Again, this is the only way we can have data and where we can know how cardiology is being implemented in different parts of the ESC countries. And this is certainly one area where it's very important that we reinforce this program, which again has had your participation and your involvement. One important development that occurred during Panos Varda's presidency was the opening of our Brussels office, the European Heart Agency, where we're developing a whole set of programs which basically expand the whole breadth of different programs that we are organizing at the ESC. These are the three main pillars of this European Heart Agency. So one part is devoted more for advocacy, for European affairs. One, the European Heart Health Institute, where one of the main products, there are several, as you can see here, several areas, but one of the main products has been the development of the Atlas of Cardiology, which I will explain in just 1 minute. And then the European Heart Academy, where we are organizing different courses, some of them with some European universities. And this has been also a very successful program that we're also putting a lot of energy and resources as well. So the Atlas of Cardiovascular Data, it's been a program which basically is a collection of the cardiovascular data in the different ESC countries. And again, thank you to also to the Israel Heart Society for helping to put the data in this country, but basically provides a whole set of information. And our goal is to have sort of a small OECD for cardiovascular medicine based in Brussels, where we can provide this data, which is now online. It can be used in many ways. It's really fantastic. If you have the opportunity, go to the website, and there's a lot of information there that can be used also as benchmarking to compare different countries, different areas. And for the first time, we do have real data and valid data about cardiovascular medicine in different aspects in the different ESC countries. This is the European Heart Academy in terms of the selection of courses that have been organized with different universities. And again, this is a new program. It started a couple of years ago with the heart failure program with Zurich University. It started also a program in cardiovascular management with the London School of Economics, and we have two programs which will start soon with Maastricht in arrhythmias and also with Hamburg in the German Cardiac Research Center on translational cardiovascular medicine, and other ideas are still in development. So our big event annually is the Congress, and we had a very fantastic Congress in London last summer. We're going to have another one in Rome this summer. We had a very good participation from colleagues coming from Israel. There were over 130 members that attended the Congress. You had about 50% acceptance rate of the abstracts that were submitted from Israel, and there was also, I would say, a good participation of faculty in the Congress, but we certainly encourage more and more participation, not only at the main Congress, but also at the Congresses of the subspecialties of the associations and of some of the councils and working groups. We're going to have very soon the meeting of heart failure in Florence, and also the meetings of the other associations, which again, we really much encourage the participation from colleagues coming from this part of the world. I've been lucky enough to be in this country many times, and I had a chance to make new friends. I consider a lot of people here that are really have been over the years narrowing our relationship. These are just a couple of photos that I took from my memories that show different times I was here, and I really appreciate. I'm very honored to be in this country and to be here. Very honored to be the president of the society that has a society as your society, and we're certainly looking forward to have a lot of you coming to our main Congress in Rome, but most of all to engage with your society, with our society, so we can fulfill our mission to reduce the burden of cardiovascular disease and do better patient management. And with this I will finish, and again, thank you very much. Tada.